To Amo Raju, disability and charity expert. Good afternoon to you, Amo. Nice to have you with us.
Good afternoon. I'm glad to be with you.
Well, I made the point to Ben just then, which I'm sure you'd agree with. I can't just go, like, for example, today I've got to drop a man flu. You know, as a fellow male, you know what that's like. It's not pleasant, and therefore I'm not feeling great. But here I am at work, giving it a good go. If I went to my doctor this afternoon, to my GP, and said, actually, it's a bit more than that, doctor, I'm actually feeling quite anxious. I think I've got anxiety. Not depression, not bipolar or anything like that, just some anxiety. I got a funny feeling I'm not going to be given a PIP payment anytime soon.
Yeah, you're right, and there is a qualifying time period as well. I think. I mean, I've not done disability benefits support for a while myself personally, but there used to be a 3-month lead-in, so you can't just turn up on at a GP appointment, say I'm feeling anxious or I'm feeling depressed.
Yeah.
I want to apply for PIP. It doesn't work like that. Absolutely not. My thing here is that we need to look at the root causes of why people are feeling anxious, why people are feeling depressed. We've just not long come out of a pandemic, which for a lot of younger people, I'm not going to use the pandemic as an excuse, but it is certainly something to consider. A lot of younger people have lost a lot of confidence, and there's a whole generation that is more connected to its phone and PC than it is socially to friends and extended circles. Excuse me. So there's a lot of work to be done in society in terms of getting people confident, feeling good about themselves, and feeling able to feel equal in applying for jobs and then retaining those jobs,
Yeah.
and at the same time talking to employers about what they could be doing in terms of looking at their workforce.
But have we, sorry to interject, but do you think, and this is what Ben, our previous guest, not unreasonably said, look, he thinks perhaps the system takes the path of least resistance. It's so convoluted, it's time dependent, and whether it's the GP, whether it's the DWP, nobody has that amount of time. And simultaneously, perhaps young people in particular have sort of recalibrated or reimagined what depression is. And that's not to underplay what people feel, but feeling anxious and having a bad day. Have we almost redefined that predisposition to become sort of a full-blown issue where you've got something that actually most people get from time to time?
I think it's like with anything. 10 years ago, as a country, as a society, we weren't talking about mental health and anxiety as much as we are today. So it's out there in the news. So there's a whole generation of people waking up to this conversation around mental health. So there will be some self-diagnosis. There will be some people who, but equally, there's a lot of people who are anxious and depressed and going through what I call having a relationship with depression and mental health, because it fluctuates. There's no such thing as a cure. Even antidepressants do not cure anxiety and mental health.
But can there be that many? I mean, that seems to be the argument, which I know you're familiar with, and I'm sure you even understand it, where people go, I mean, yeah, of course, we all hated lockdown. When you look back at it, it's actually quite frightening. You have to stop thinking about it because we remember what we couldn't do, and those journeys that you did make in the car, and there was nothing on the road at prime time daytime, and it was horrible and awful, and nobody disputes that would have had an awful effect on people, particularly those that didn't even have a garden to go walking around in. So we all get that, but I think there's an understandable, not even a suspicion, but concern, shall we say, that surely we haven't, in a few short years of this human journey of ours, suddenly found ourselves with over 1 million more people who have clinical depression.
No, but there is a lot of anxiety out there, and there's a lot of good reason for people to be anxious as well, and that leads to other conditions. There's a strong connection between mental and physical disability. It can manifest itself in physical kind of physical ways. You can start to feel physically weaker as well, and so it's not a case that there's a lot more people out there who are self-diagnosing, or there are a lot of more people who are suddenly saying I'm depressed because that's what the trend is. It's simply because there's a lot of anxiety out there, and I think back to what I said earlier, we've got to get to the root cause of why people are feeling this way. Whether it's poor income, whether it's social isolation, whether it's people staying at home and choosing to work from home instead of getting back to the office. Some of those kind of solutions need to be put back into the mix by employers. And one of the things I also say is that we need more disability charities having that conversation with DWP. And I know that was something that came out in the last statement by the government, that they will involve disability organisations when they're looking at welfare reform. But they're the best people to help get people back into work and get people off benefits if they don't need to be off benefits, because normally they're run by disabled people themselves, and they're the best experts in assisting. So I think that's a strong argument to be put forward to the next time this conversation. And the next time, it happens all the time. The conversation continues, but we need more and more conversations with disability organisations, user-led organisations, to talk to the DWP and the government directly on such issues.
Yeah, no, well, on that point, it certainly sounds fair enough. Listen, Amo, thank you for your time, sir. Really appreciate that. Dr. Amo Raju, disability and charity expert.